DBT, Dialectical Behavioral Therapy. It was created by Dr. Marsha Linehan, especially for those who are with borderline personality disorder and those who are intention highly highly suicidality behavior. It was further used for depression and anxiety. It has four principles: mindfulness, to be present, to be present minded, mindfulness to cultivate a present minded, a present awareness of the environment and their own emotions. Mindfulness, emotion. Second is emotional regulation, teaching the client to how to regulate their own emotions, especially in times of crisis or in times when they are in tense, to help them not to distract their mind or censor their emotions, but to be present minded, to be aware of their emotions of the environment, and to 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 regulate their own emotions. Like for example, uh, mindful breathing or another therapeutic technique from the CBT. Dialectical behavior therapy is a mixture of cognitive behavioral therapy and Gen. And the third is the third is distress tolerance, teaching them how to tolerate with during the distressing times, to help them deal competitively. And then four is interpersonal skills, to help the client the the assertiveness and problem solving skills, so that they may effectively deal with people interpersonally. The therapeutic is comprised of four components. The first is individual therapy, then the second is group technique skills in, in group therapy settings. It can be about 2 hour to two and a half hour each week in their treatment plan. And then the third is uh, to help the therapist to deal with the burnout from the therapy, to help the client, to help the therapist to deal effectively, to have the therapy after after the treatment session, so that they can deal with the burnout. And then the fourth is phone coaching. That means there will be some there will be some group within this DBT treatment plan, so that the group will help the client when in times of crisis moments, whenever the client have a phone or contact the treatment center through phone call or through phone call. And then in therapy, there's three stages after comprehensive examination. There is three stages. The stage one is to 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 make a contract or to make a deal with the client, saying that if they if there's any harm to themselves, if there's suicidability, there may be there will be disruption in the treatment plan. Then the stage two is to help the therapist to help the client how to deal less intensely with their emotions, less intensely with their emotions during the moment of crisis or during the intense moment. And then the third stage is for the therapist to help the client whatever the client has learned from the therapy session to reinforce that skills, to further to further strengthen their skills, so that the therapy may so that even after the therapy the client may be able to deal effectively. This is for the dialectical behavioral therapy. Okay.